Thank you very much. I'm very proud to be in front of my peers today. This is the group that is leading the way in support of a toxic-free dentistry. IAOMT is truly ahead of its time. We are the dentists that have grown up to the realities of our practice. What I want to talk to you about today is on the tip of the tongue of awakened dental patients everywhere. We get an inkling of what that is by doing a Google search. Just type in "mercury is ubiquitous." Now that's an esoteric term if there ever was one. The phrase increased its search response from 250,000 in 2009 to 950,000 in 2014. The internet has changed everything. Big data is upon us and people everywhere are sharing their knowledge. But within this there is opportunity for us if we can see what's in front of us. This requires we take a new look at our practices and how we can present what we do that will reach awakened patients. So what's on the tip of the tongue of today's dental patients? It's health. They're looking for answers, not side effects. For many, true health has been elusive. In our professions, for many dentists, health has not ever been stated as a major goal. Today, patients are bypassing the ways we used in the past to acquire new patients. Literally every dental magazine is proposing we better get busy with our website to create an entrance for new patients. They're discussing how we should attract them. But the secret is not some new patient vehicle to try, but rather it is to meet the demands that people are expressing by their free actions of inquiry. They want to be in control of their health and want to find real information they can use. They want to maintain a freedom of choice. They want someone who understands their desires and will help them. It is true, after all, as dentists, we are being subcontracted in their quest for health. How can we transform dentistry? How can we be relevant in the internet world? By providing a guide or formula based on a natural dentistry approach that bring understanding to the quest for health. With this basic formula, the dentist can immediately give insight and path to health. Do you want to know the formula? Okay. But before we do, let's look at the use of the word natural. We're certainly not carving teeth out of tree trunks or elephant ivory. No, that's not the point. But the point is, we are treating in accordance with what is found in nature. We take the way the human body functions in its ideal state and put that into a standard platform for dentistry. Our end product is physical health. The formula for that is, it's structure plus nutrition minus toxicity equals physical health. This formula is critical to our practice of natural dentistry as it helps the patients and our staff alike to address the correct problems in a way that leads to a lasting solution, not a fix today that becomes the source of further problems down the line. Patients entering our office have their guns cocked, are well informed, and they want something. If I can help them get into a groove, the correct runway, if you will, to assist them in their think, then right away I become their ally. This is where the formula comes in. It helps patients see the very real barriers they are encountering in achieving their goal of health. Incorrect structure, bad nutrition, and lots of toxicity. These are the barriers. Let's face it, having a body can be a problem as well as fun. However, we can help the owner of that body achieve what they consider wellness or health. It is they who must know that high motion is desirable. We don't revere those people lying in beds in nursing homes like we do those highly paid athletes now, do we? So having the formula produces a pattern, a template for the direction toward correct treatment with the individual patient. Physical health, after all, is not a finite condition or an absolute state that someone finally achieves. It is a statement of the overall condition of a living organism at any given time. It is the continuing result in the present time of the factors of a balanced structure, good nutrition, and no or little toxicity. Let's look at each part of the formula. Structure. Structure is the most misunderstood of the three parts of the formula. Within a lifetime and over generations, the body structure changes. Here, from the side view, we see what can happen with the structure from birth to death. In the face of accidents, poor nutrition, occupational repetitive motions, leg length differences, and gravity, the body structure can aberrate or move off its optimum position skeletally. Proper structure, holding the form of the body upright and balanced, permits flows, essential for energy distribution to the cells, for unrestricted nerve flows, for proper oxidation and detoxification. The optimum or ideal structure is seen in this video segment with Marisa and Andre. See that both are erect, with heads up and shoulders back. This enables optimum motion. The lungs can fill to capacity, and the conductor's synchronous motions enable the highest and best creations of mobility. We're looking at art, body art. In this next video, you see a man walking down the hallway with his back to the camera. Notice the hitch to his gait as he repeats his steps. When we view his smile, it is apparent that the vertical dimension of his bite is overclosed by his class 2 jaw relationship. In the frozen shot of his opening, his lower front teeth are apparently quite worn. He's received lots of dental care, yet both of these structural problems, that is the vertical dimension, his nose to chin relationship, and the way his jaws actually go together, can affect his postural chain and obviously compromise his mobility. There is a structural correct bite position that keeps the head and neck in proper alignment to the rest of the body, but its position can be compromised, affecting the entire health potential of that body's motion. We quantify the structural imbalance using the Myotronics K7, which measures mandibular movement and masticatory muscle functions to discover for the patient the occlusal position that is the most compatible with a continued state of relaxation and proper functioning. Patients see their jaw joint is slapped back into a place where the blood flow is jammed. They understand why they have problems with a cracking jaw, or feel knots in their trapezius muscles, or have experienced sleep apnea. With the K7 results, we can establish the model occlusal position that guides all future work with this patient, from a single crown replacement to removable partials and dentures to complete fixed dental revisions. An experimental project with the St. John Clark Pain Clinic, where they use neurosomatic therapy to restore structural balance up and down the postural chain, we tested a bite registration created in our office from the K7 information, along with an 8 millimeter pelvic lift needed by the patient per their analysis. Let's listen live as Paul St. John discovers what happens when the registration holds the bite in its correct position.
Okay, so now we want to see that the pelvis being level made a substantial difference in your strength, because it's the difference of building a building like this or building it like this. Right. Let's check now this bite registration that Dr. Behm has made for you. Okay. Okay, and just fit that in and there, I think that. Good. All right, now let's check this. Okay, same position. Ready? Resist. Oh, well, that's substantial. Can you feel how much stronger you got?
Yeah, absolutely.
So actually, when your occlusion is balanced, that even has a bigger effect on the strength of your body than actually balancing your pelvis. Wow. And the other thing that's real evident is the moment you put that in, your head went like this. Without it, your head is here. Even though your shoulders got straight with the pelvic lift, your head still stayed tilted. But the moment you put that in, now you're completely on the mid-sagittal plane. That's important because it righted your cranium as well as got substantially stronger. what we want to do now is check your spine angle. So we'll put this underneath the ilium, okay, and you've got your registration in, okay. Now we want to look back, okay. Now I want you to just shrug your shoulders because you can see, oh my goodness, that curve has gone. That actually has straightened your spine. Yeah, it's very easy to see how straight your spine has become. So this is where the angle was substantial. And you see your shoulders are level, your cranial base is level, and your spine is straight.
Behold, a straightened spine. That's not supposed to happen within the realm. But clearly the corrected bite position had a tremendous effect on the structure. And correct structure will balance the body significantly, giving increased strength and range of motion. Next, nutrition. Nutrition and structure in the health formula are intimately tied together, and interestingly enough, nutrition seems to supersede structure in importance to life and motion. Nutrition is any substance that provides nourishment essential for growth and maintenance of life. It is now becoming evident throughout many different disciplines that if we give that body what it needs nutritionally, all manner of afflictions will be remedied. Weston Price, a Cleveland dentist in the 30s, traveled to isolated parts of the world to study populations untouched by Western eating habits and found beautiful, remarkably straight teeth, free from decay and resistant to gum disease. He isolated the common denominator among the populations as diet. They were all eating foods rich in essential nutrients, high in water-soluble vitamins, and high in mineral content from very cholesterol-rich human sources like butter, fish, eggs, organ meats, and animal fats. These nutrient resources acted as a catalyst to mineral absorption and protein utilization, promoting good health. According to Weston Price, tooth decay comes from three factors. 1, not enough minerals in the diet. 2, not enough fat-soluble vitamins in the diet, A, D, E, and K. 3, nutrients not being readily bioavailable. We have to look at the Francis Pottinger studies to make this connection very clear. In the 1940s, Pottinger began a 10-year study using 900 cats to determine what effect nutrition had on structure. One group of cats ate nothing but processed foods, and after 3 or 4 generations, the offspring could not reproduce. You can see here they had problems with strength, range of motion, and balance. And remember, this degeneration was exclusively nutritionally caused. This gives one pause when considering what today's food is doing to the structure of humans. The evidence is all around us. Poor nutrition begets degenerating structure. In dentistry, that can be seen in the predominance of narrow jaws and the off-register bites. The take-home message or cliff notes from these 2 videos are: dental caries are more a result of poor nutrition from poor soils rather than sugar as the sole cause. Melvin Page brought to light for me that the energy, the minerals we expend in eating hollow foods creates a carious oral condition. There is evidence that bacteria are not the cause of caries because they do not consume processed carbohydrates due to the lack of nutrients in them. It follows then that the structural abnormalities like the narrowed, collapsed dental arches with crowded lower front teeth, the genetically missing teeth, and malformed dentation found today in Western cultures are example of nutritionally caused structural change. Nutrition in our formula is achieved by producing and eating high-density, high-energy therapeutic food fully capable of rebuilding human health. I underscore rebuilding, including minerals which are actually the carriers of energy. Real nutrition delivers energy which is required to achieve optimum motion. It is clear from Jerry Bucco, the renowned oral pathologist from Houston, Texas, and Norman Thomas, both of these people's hypothesis that our skeletal structure and poor nutrition is collectively flushing our human form down a proverbial drain. Well known to this audience is the third component of the formula, toxicity. The bacteria-laden dead teeth and the periodontal issues have long been proven and beat to death by the focal infection theory of our forefathers in dentistry. The dental question today is, what are we doing about it? The formula is a transformative idea that opens the door for patients to see and demand the procedures that eliminate toxicity, the root canal extractions, the cavitational surgery, etc. It is true that the difficulty of expense and letting go of body parts plague the average well patient. Opting in for surgery is a last resort for the many physically compromised patients, as it is well known that autoimmune, local, and even generalized situations must be handled first. In hygiene, the promise of ozonation and the subgingival air polishing instrumentation have arisen to be called upon to annihilate these sulcular toxins. These tools the dentist can apply. Surgical extraction and removal of metals is the holistic dentist's mainstay of activity. This practice will remain for our lifetime or until physical medicine awakens and separates itself out from the grasp of the pharmaceutical industry mindset. So in closing, because of its overall health focus, natural dentistry contains the technologies and practices that represents a leap forward for patients and for the dental profession as a whole. Because of the increasing patient demand, we must do everything possible to incorporate these procedures into our practices and to mainstream these ideas. To that end, we have launched a Natural Dentistry Evolution website to disseminate natural dentistry approaches and as a communication vehicle for all of us who want to contribute to this dental evolution. We invite you to visit the site and sign up to receive the latest updates on the grounds game. With natural dentistry, we achieve a better and healthier life for the patients in their own estimation. Thank you very much for listening, and I hope we can be in communication and participate together in achieving improvement. Thank you for everything you do.